So when we talk about ACL, we need to be able to visualize ACL in all three dimensions and functioning all three planes and not necessarily in a single plane or a two-plane motion. So we need, if you're looking at an athlete moving, accelerating, decelerating, and then changing direction, we need to be able to understand the loads that go through the ACL in all three planes. So we're talking about restricting that tibial internal rotation in the transverse plane. We're looking at restricting the valgus and varus forces in the frontal plane, and then restricting that anterior tibial translation in the sagittal plane. Now, this is an overview of all the factors that potentially contribute towards ACL injuries. Today, we're going to focus more on the modifiable biomechanical factors, but we would be failing ourselves if we do not take into consideration the contribution from neuromuscular, neurocognitive, or the environment that can come into the picture for an ACL to occur on the field. So when you talk about non-modifiable factors, as Miten already mentioned, there could be variations in the femur itself. So the tibia itself, you would have higher than normal posterior tibial slopes, or you could have a femoral notch, which is a little abnormal in terms, and that can contribute. Prior injury history, very well, we are all aware of, and not necessarily previous ACLs only, but an ankle sprain can also be a contributor. Or if you're training an athlete to come out of a sports-related concussion, and they have visual spatial attention deficits, and that can also contribute. In terms of developmental and hormonal, we are all aware the ACL tensile strength itself can be a factor, and your genetic makeup has an influence on that. Females, we know, are more predisposed to getting ACL injuries, and something interesting, we'll look at it in a while, which is prepubertal and postpubertal ACL injuries. So this is a very interesting paper by Magnuson and colleagues which talks about the heritability component in terms of ACLs, and they found that there was a very high variance when it comes to genetic makeup. This is a twin study approach using differences between identical twins and non-identical twins. We know that identical twins are sharing the same set of chromosomes, so you would have higher variance. So a very interesting thing to talk about if you have a client who presents to you with familial predisposition of ACLs, so something that you can have a conversation about. When it comes to data coming out of India, and we see this variance about males seeming to be more predisposed to ACL injuries as compared to females, which we know is not really matching data points coming from global research, and we know that females are heavily predisposed to getting ACLs. Now, the probable reason for this happening is a traditionally higher male participation in sports, which we know is fast changing, and we can expect a change in this trend in the coming years as more and more female participation happens in competitive sports with the ongoing national programs by the government. But on an average, we can broadly say that females are about 2 to 8 times more likely to suffer from an ACL injury, and there are two gender-specific factors that might predispose. One is the hormonal variance you see around puberty, where up to puberty, males and females seem to have this linear fashion of growth in terms of physical parametrics, but then around puberty, males get this dose of testosterone, interleukin growth factors, and growth hormones, and they tend to sort of drift away a bit in terms of physical parametrics. The other being this adoption of risky landing strategies, which has been observed in females. If you can appreciate the female in the sagittal plane, you can see that there is a more upright trunk when she's landing. There's lesser hip and knee flexion angles, which means that she's going to have a more quad-dominant pattern of landing. You can appreciate in the frontal plane, there is that dynamic knee valgus that everyone talks about, and that probably comes from a poor frontal hip control in the frontal plane. What we've observed is there is lesser and later gluteal activation in females, which probably predispose them a little more. There's a very interesting study coming out from Orishimoet and colleagues where they observed that if females at an early age were trained for jump-specific and balance-specific training, then they were able to counteract these potential risk factors. So something we should advocate a lot about to our clients and to younger females to get into jump-specific and balance-specific training. So good promotion for ballet and contemporary dance forms there. Now, another important, interesting study coming from Meyer and Chu colleagues is talking about if you're active around your growth spurt as a young child, you have a lesser tendency to have injuries overall compared to children who are less active or more sedentary around their growth spurts. And again, as physical therapists, we should be very strongly advocating children being very active around growth spurts. Now today we're going to dig into the modifiable biomechanical factors, but we should be acutely aware that the neuromuscular component is a major contributor. When it comes to biomechanical factors, primarily ground reaction force, because all sports at a competitive level will have higher ground reaction forces. So you're trying to oppose very high anterior tibial shears in the sagittal planes. The center of mass is interesting because if you have a more lateralized or a more posterior or a more higher center of mass when you're landing, then your quads breaking force is going to be higher, and that's going to lead to higher strains on the ACL in the sagittal and coronal planes. Knee valgus, I think I don't need to dig into this a lot. Physios know about this a lot, dynamic knee valgus and how it can have an effect in the coronal and transverse plane on strains in the ACL. Trunk sway and trunk rotation are a little interesting because what is observed is if your athlete has a tendency to do ipsilateral trunk sway or ipsilateral trunk rotation when they land on the stance limb, then they have higher strains going through the ACL and then probably predisposes to higher loads. Knee flexion angles, again interesting because you're having lesser knee flexion angles as you land or as you're changing direction on the stance limb. That means you're going to have a higher braking force in the quads. That means you're going to have a higher strain in the ACL. Tibial rotation, so if your athlete has a tendency to land their foot in external rotation position, that consequently means your tibia is going into internal rotation. That consequently means you have a higher dynamic valgus, consequently more strain on the ACL. Foot strike pattern is again interesting. If an athlete has a heel strike pattern compared to a mid-foot strike pattern when they land on the stance limb, means they need to generate higher braking force in the quads, means there's going to be higher strain in the ACL. So I would just apply this in a real world scenario. We see Kate going through her Australian footy match and she drops down. I'm just going to slow that down over there. And if we can appreciate the moment at which she's trying to change her direction, the knee buckles over there and she goes down. All right? I hope you're able to appreciate that. Now, if I were to take a snapshot in time of the moment just before the injury occurs, and that's how she would look when she's just about, her weight is going through that stance limb and she's going to change direction, and I put up my factors on the side, we can all appreciate that Australian footy is a high intensity game, so it's going to have higher ground reaction forces, and obviously she needs to bear higher anterior tibial shears, which need higher quads braking forces. If you look at a trunk over here, if you look at the trunk and if you can appreciate that the trunk has an ipsilateral trunk sway and an ipsilateral trunk rotation towards the stance limb, so her center of mass is suboptimally placed and there's a higher force going through that knee over there. If you can appreciate her foot, it's externally rotated. What we just explained, there's going to be a consequent tibial internal rotation and then higher forces going through the ACL over there. And the heel strike pattern, which requires higher quads braking force. So all of these factors coming together resulted in that injury happening. Now what we need to understand and we need to be very clear about is presence of one or two of these factors is very well managed by the athlete on their own, and you really don't need to intervene over there. And you really don't need to say them, oh, hey, I saw this factor, you need to change it, come down to my clinic, let's work on it. That's not the picture we are trying to convey. What you need to understand is a cluster of factors needs to come together in that moment in time with those environmental conditions, with those neuromuscular conditions, factors present for an ACL to occur. So remember that a cluster of factors needs to be present for an ACL injury to happen. Otherwise, we would have an ACL in every other football or a tennis game or a cricket game that we played. Higher number of factors present obviously increases the risk of ACL injuries because then there are higher stresses going through the ACL ligament. So the take-home message from this concept is if you're trying to train an athlete to sort of prevent ACL injuries, or the reduction in ACL injuries would be the right word to use, we should be able to introduce some of these concepts into their prehab training programs that we create for them. And if you're trying to get an athlete back from an ACL injury to return to sports, you should be aware of this. And if they have a tendency to have any of these factors, then we should try and correct them as far as possible, being mindful of the fact that this requires a lot of time. All right? So thanks.